Hi, everybody. Welcome to ACT Task 1. We're going to briefly talk about the task, how to get started in it. A lot of students have many questions because it's their first task. They do a WGU in the nursing program. And so I want to hopefully help clarify some of the questions that you might have. First off, before we even get started, I'd like to recommend this website. It's the Owl at Purdue Writing Lab and their website. If you do a Google search for the Owl at Purdue, find it, and I would recommend bookmarking it. It's a wonderful website about APA format. It gives you many options as far as the basics, basic general APA guidelines, how to do in-text citations, how to reference your sources within a reference list. So this is a great website, and all of your papers throughout your program at WGU are going to have to be in format. So this is a great thing to become familiar with early on. All right, so first off, I'm going to go into task stream. I'm hoping that all of you have clicked on that Begin Now button in your degree plan next to ACT1 so that you have task stream in your account. And when you log in, this will be similar to your homepage. You're going to have all your folios here with for your different courses. We're going to click into ACT1. You're going to see over here on the left-hand side, there's ACT1 Task 1 and ACT2 Task 2. We're going to go to Task 1. This task covers the competencies of therapeutic communication, culturally competent care, health management, and then growth and development across the lifespan. So first off, you're given a scenario about a young woman named Jane and a brief history, including diet, religion, her health in particular, some things that you find on examination when she's brought to the hospital. And then they make it very clear by giving you Jane's primary nursing diagnosis, and they list it as impaired gas exchange. You are then given the task, which is here in Section A, items 1 through 5. And then Section B, you're going to be creating a couple of care plans, and we'll talk about those in just a moment. First off, the task, you're asked to write an analysis paper. It needs to have at least one citable reference, meaning it has to be a scholarly reference. Typically, people are referencing your Kosher and Herbs texts, and so that tends to be their reference. But as long as it's a scholarly reference that you can cite, something else is fine as well. First off, they want you to summarize Jane's history. It can be very short. Jane's a 26-year-old from Vietnam. She's here on an academic visa. It can be very short and concise. It doesn't have to be very in-depth. The next section wants you to talk about how Jane's history and her prior behaviors relate to these 3 different developmental theories. They ask you to talk about Erikson's growth and development theory, Freud's, and also Maslow's needs theory. Those are all in your book. Those were also included in a lot of your required reading. And there's a lot of tables within your book that can help break those down very simply. And what you're going to want to do is you're going to take the information you're given within the task, within the scenario, and you're going to assess where you think Jane falls into each one of these theories. The next section asks you to explain how each theory is relevant to her plan of care. So you're going to find out where Jane falls in these theories. You're going to talk about that. Then you're going to talk how it's going to affect her plan of care. This tends to be one of the stepping stones in this task that can trip students up. Very briefly, we formulate our plan of care based on an assessment of a patient. Each patient needs something different. They're going to come with their own history, with their own background, their own education level. You don't speak to a 15-year-old student the way that you would a 50-year-old educated businessman. You're going to speak to them different. They're going to have different needs. Much of our care as a nurse and much of the interventions have to do with patient education. And so really utilizing that assessment piece helps us develop our plan of care. So us knowing where Jane falls in these developmental theories helps us predict her behavior and what she needs as a patient. The next part, section 4, asks us to discuss how the nurse will adapt care to meet Jane's cultural needs. Now, Jane is Vietnamese. She's from another country. She has very specific dietary beliefs as well as religious meditative beliefs. So, what can we do as the nurse to, adapt our care within reason to meet Jane's cultural needs? And there's a lot of things we can do. They want you to justify each adaptation, meaning they want you to why you're doing what you're doing, how the action you will take will adapt to meet Jane's cultural needs. The last section wants you to talk about how the nursing process is going to assist the nurse in planning Jane's care. And they also want you to include a specific example. So take one of the sections of the nursing process and provide an example, a very specific example of what you could provide for Jane based on that. One of the things I'm also going to mention to you is when you are writing anything, a task stream, you're going to find that the tasks are all basically outlined. One of the greatest tools that you have is this task, how it is outlined for you. They tell you exactly what you need to write and how you need to write it in the order in which you need to write it. If you continue to the bottom, you'll see they also include the evaluation method, which we use rubrics. You can view the rubric. So if you use the rubric in combination with the task, you can essentially meet all the competencies of the task based on what they've told you. They've given you what you need to accomplish. Um, Obviously, you want to meet this far right-hand corner or column, the satisfactory value of 2. You want to get 2s on all those. And if you read the little summaries, they're going to tell you exactly what you need to accomplish, which is one of the greatest parts of Task Stream. I love it. It tells you exactly up front what you need to do. Second part of the task has to do with formulating care plans. You're going to do 2. You're going to use a template that WGU gives you, found below, and then you're going to create 2 care plans. They give you 4 options of nursing diagnoses that are reasonable for Jane. So you get to pick 2 of them, and then you're going to formulate your care plans on the template. If you scroll down here, you're going to find the nursing care plan template. You will see this is the WGU nursing care plan template. It has a space for you to basically fill in everything. What I always like to equate the care plan to is for students, the care plan is the written form of a summarized nursing care nursing process for a patient. It includes all the assessment information up here with the objective and subjective data. It includes the diagnosis. It includes the planning. It includes the interventions and the evaluation by whether or not patients are meeting their goals. So this really does help. You're going to want to first look at the history and fill out the subjective and objective data. You're given those options of nursing diagnoses, so you can pick one or 2 of those. You're going to create your etiology statement, which is a statement of what your nursing diagnosis is related to. Ineffective oxygen exchange related to constricted airways as manifested by decreased oxygen saturations. That's what you call your problem event statement or nursing diagnosis statement. This tends to be kind of a tripping point for students. If you have questions, just let me know. Etiology is something that you are relating the nursing diagnosis to a physical manifestation of it. You want to bring it to as much of a cellular level as possible. That example I just gave you of ineffective oxygen exchange related to constricted airways, I'm not a medical doctor. I'm not making a medical diagnosis. But because I, as the nurse, can hear wheezing, I can state that she's having restricted airways or constricted airways. So that's kind of how you form your diagnosis statement. I would encourage you highly to read your chapter. I believe it's chapter 12 in Kosher and Herbs that has to do with diagnosis, and brush up on how we formulate nursing diagnoses. Also, if you need to consult the NANDA.org website, that's the North American Nursing Diagnosis Association website. Um, you can, kind of look over some stuff and hopefully understand why nursing diagnoses, the etiologies, are all kind of in a standardized language. They do that for a very specific reason. It's just so that we're all speaking the same language, basically. Um, so I encourage you to go to the nanda.org website just to help you understand how this stuff is formulated. And then the signs and symptoms are the signs and symptoms of whatever is going on for the nursing diagnosis. Down here, you've got a spot for 2 short-term goals and a long-term goal. You've got a spot for your nursing interventions. So the nursing interventions area are what are you as the nurse going to do? What actions are you going to take to help the patient meet these goals? Then over here, you're going to fill out a rationale for each intervention. Why is this intervention that I've created going to help the patient meet the goals? So they all interrelate. In general, short-term and long-term goals have very specific time frames. They need to be measurable. We have to be able to evaluate whether or not the patient met their goals. We have to be able to evaluate hard and fast what we're doing is helping or moving the patient in the right direction. So short-term goals, generally the rule of thumb is hospitalization can occur anywhere between hospitalization and 2 weeks post-discharge. And long-term goals occur anywhere between 2 weeks post-discharge to 6 months post-discharge. So you can see how there's a vast difference, whether it be completing a smoking cessation class, whether it be just quitting smoking, whether it be having your follow-up appointments, whatever it is that are goals for these patients, you have to make them so they're measurable. It needs to be definitive and within a time frame. So if you have questions once again about that, let me know. But those are a couple of the guidelines that you'll need to successfully pass this. Like I said before, I would recommend you utilize the rubric and the task as it's laid out to outline your paper and prepare for it. And if you have any questions as you move forward, please let me know. I'll be happy to help you however I can. Good luck starting.